Welcome to today's video, where we'll be discussing ureteral trauma, a serious condition affecting the urinary system. We'll explore what it is, what causes it, how it's diagnosed and treated, and what you need to know to understand this injury. Ureteral trauma refers to any injury to one or both ureters, the tubes that carry urine from the kidneys to the bladder. The causes can be broadly classified as either external or internal. External causes commonly include motor vehicle accidents, falls, or penetrating injuries like gunshot or stab wounds. Iatrogenic injuries, meaning those caused by medical intervention, represent a significant portion of ureteral trauma. These can occur during complex surgeries like hysterectomies, colon resections, or procedures involving the abdominal aorta. Kidney stone removal procedures, particularly those involving scopes, can also, albeit rarely, lead to ureteral injury. Radiation therapy can also lead to ureteral trauma. When a ureter is injured, several things can happen. Urine may leak from the injured ureter into the surrounding tissues. This urine leakage can cause inflammation, irritation, and potentially lead to infection, abscess formation, or even sepsis, a life-threatening condition. The body's natural response to the injury and urine leakage is often to form scar tissue. This scar tissue can narrow the ureter, leading to a stricture, which obstructs the flow of urine. Prolonged obstruction can cause hydronephrosis, a swelling of the kidney due to the back-up of urine. Over time, hydronephrosis can damage the kidney and impair its function. Ureteral trauma is relatively rare, with iatrogenic injuries accounting for the majority of cases. Due to the increased utilization of minimally invasive surgical techniques, the number of iatrogenic ureteral injuries may be increasing. Motor vehicle accidents are a leading cause of blunt abdominal trauma, which can include ureteral injuries. The incidence of penetrating ureteral trauma is highest in areas with high rates of violence. Specific population at risk includes those undergoing complex abdominal or pelvic surgeries, or those with pre-existing urinary tract conditions. Symptoms of ureteral trauma can vary depending on the severity and location of the injury. Some common signs and symptoms include flank pain, which is pain in the side or back. Hematuria or blood in the urine may also be present. Fever and chills can indicate an infection related to urine leakage. Nausea and vomiting can occur due to pain or kidney dysfunction. In some cases, there may be no immediate symptoms, and the injury may only be discovered later during imaging for other conditions, or when complications arise, such as persistent abdominal pain or urinary leakage. Diagnosing ureteral trauma requires a thorough evaluation, often involving imaging studies. A CT scan with intravenous contrast is the most common effective method for visualizing the ureters and detecting any injury. An intravenous pyelogram (IVP), which involves injecting contrast dye into a vein and taking X-rays as it travels through the urinary system, can also be used. A retrograde pyelogram, where dye is injected directly into the ureter through a cystoscope, may be necessary if a CT scan or IVP is inconclusive. In some cases, a cystoscopy, a procedure where a thin tube with a camera is inserted into the bladder, may be used to assess the lower ureter. Ureteral trauma can be classified based on the mechanism of injury: blunt, penetrating, or iatrogenic. It can also be categorized according to the location of the injury within the ureter: upper, middle, or lower. Finally, the severity of the injury can be graded from minor contusions or hematomas to complete transection or separation of the ureter. The treatment of ureteral trauma depends on the severity and location of the injury, as well as the patient's overall health. Minor injuries may be managed conservatively with a ureteral stent, a small tube placed inside the ureter to allow urine to flow freely and promote healing. More severe injuries, such as complete transections, often require surgical repair. Surgical options include ureteral reimplantation, where the ureter is reattached to the bladder, ureterostomy, where the two ends of the ureter are sewn back together, or, in complex cases, more extensive reconstruction using bowel segments. In the short term, a nephrostomy tube, placed directly in the kidney to drain urine, is sometimes necessary to divert urine and allow the ureter to heal. The choice of treatment depends on several factors and is best determined by a urologist. Preventing ureteral trauma involves minimizing the risk factors where possible. For external trauma, this means practicing safe driving habits and avoiding situations that could lead to penetrating injuries. For iatrogenic injuries, careful surgical technique, a thorough understanding of anatomy, and the use of appropriate surgical instruments are essential. Intraoperative techniques such as ureteral catheterization and the use of indocyanine green and ICG fluorescence may help to identify and protect the ureters during surgery. The prognosis for ureteral trauma depends on the extent of the injury, the time to diagnosis and treatment, and the patient's overall health. Early diagnosis and appropriate treatment can significantly improve outcomes. Delayed diagnosis or inadequate treatment can lead to complications such as strictures, hydronephrosis, kidney damage, or even kidney loss. Recent research focuses on improving surgical techniques, developing new imaging modalities for earlier detection, and exploring regenerative medicine approaches to promote ureteral healing and prevent stricture formation.